I'm Dr. Picerno with Jacksonville Orthopaedic Institute, and I'm going to talk to you about shoulders today. Shoulder is a very complex joint. It has more mobility than any other joint, and because of that, can have a lot of problems. And I love working on shoulders. I love trying to figure out what's going on with the shoulder. And the shoulder injuries can be everything from a repetitive use injury, it can be a traumatic injury, it can be something that even is related to trauma at birth. There's a variety of spectrums of things that can go wrong with the shoulder. Sports is a very common cause of shoulder injuries, and that can be in both the young and the old. And so I see a variety of patients that have injuries of the shoulder because of that. There are a lot of people think that there's just a few things that can go wrong with the shoulder. The rotator cuff is probably the most common thing that people will talk about. And the rotator cuffs can be injured in many different ways. And there are 4 muscles that make up the rotator cuff. And you can injure all 4 of them, you can injure 1 or 2 of them. And there's a variety of different ways in which they are treated. One of the things we can do, and I have a model here, it's called a reverse total shoulder. And what happens if a rotator cuff is chronically torn or cannot be repaired or fixed in some other way, then we have the ability to actually compensate for that rotator cuff injury. And in doing a reverse total shoulder, effectively what we're doing is moving the ball to the socket side and then the socket to the ball side. And what that does is it compensates for the lack of rotator cuff, allows the shoulder to move in a way that it wouldn't be able to if the rotator cuff was not there. So we have a lot of options in treating patients for a variety of different injuries or chronic pathology that is giving them pain.